Welcome to class today. We are getting ready for a CPR unit that will be coming up in the next week or two. Remember that you need to have a CPR pocket mask that is necessary for you to practice your CPR skills. If you have not already purchased one, you may pick one up in 303 for $5. Each of you is also responsible for your CPR certification card, which is good for 2 years. You'll need to bring in $2 and your CPR certification card will be issued to you after you pass the final test. Today we're going to go ahead and go over some basics of airway and breathing. So make sure that you copy all pertinent notes from today's lecture. I will give you a quiz over the notes from today, so please replay the video as needed. And then we will do a skill check and skill practice over how to open the airway. So before we get into the airway, let's review very quickly that last week we talked about what you do when you survey the scene. So when you initially approach a scene, you have about 10 seconds to decide if it's safe or if it's not. Remember, if the scene is unsafe, that a dead helper is not a helper, they are just dead. I have told you that multiple times, and I know you are aware of that. So in that 10 seconds, you're going to determine what you think is wrong, how many victims that you have, and if someone is available to help you as you approach the scene. You need to decide if you're calling 911 or not, but as we're going into the CPR unit, we're going to default and say call 911. And you need to decide if you need to give care first or if you need to call first, which we talked about a few days ago. As you approach the victim, if it's an adult victim, which remember for CPR purposes is someone over the age of 12, you're going to tap on their shoulder and say loudly, "Are you okay? Are you okay?" And then you're going to decide if they need CPR or not by looking, listening, and feeling for breathing for no more than 10 seconds. On a baby, you tap their foot and you ask the same question and then look, listen, and feel for breathing. After you've done your initial assessment or your primary survey, as we call it, and you decide that we need to do CPR, you will do 30 compressions first if you're on your own, 15 compressions if there's two of you on a child under the age of 12 or an infant under the age of 1. But before we talk more about the compressions, let's talk about the airway. So in order for a person to breathe or for it to be considered normal breathing, they're going to have a rate of breathing at 12 to 20 breaths per minute. But in order for them to breathe, you have to open up the airway so that it's not blocked or closed. In order to do that, you're going to do something called the head tilt chin lift technique. So on an adult, you're going to push down on their forehead and pull up on that bony part of their chin with 2 to 3 fingers of the other hand. You want the head to be at 80 to 100-degree angle to the floor. So think about your math skills. It's not perpendicular, that would be 90. You want it to be between 80 and 100. 90 would be okay, but 100 is just a little bit better. In a child, you're going to put one hand on the forehead and tilt the head a little bit past neutral. So again, 80 to 100 degrees with 100 degrees being ideal. A child is considered age 1 to 12 for CPR purposes. An adult is anyone over the age of 12. When we talk about an infant, they are someone under the age of 1. Now, as we've discussed in class, sometimes you have infants that are quite large for their size. So you do have to think about that as you're looking at them. An infant, you're going to put one hand on the forehead and tilt the head to neutral, so approximately 75 to 90 degrees. Think about what perpendicular is in math and aim for that. When you do deal with a patient that has a head or neck injury, obviously you cannot tilt the head back quite as much. So you either want to tilt the head and lift the chin just enough for air to get in, or if you can, you actually can grab the sides of each jaw carefully, which I will demonstrate in class, and open up the jaw in a modified chin thrust technique. All of this is going to be demonstrated in class. Please remember that you have to have an open airway in order for the breathing to get in. And as you're doing CPR, you have to maintain an open airway. If you let the forehead slant forward and close the airway, then it takes you longer and it makes your CPR less effective. If you look at the picture on the left, you can see that the person's tongue is blocking their airway when someone is trying to give CPR. So you're either giving breaths by blowing into a pocket mask, or by using the bag valve mask, which we'll learn about more during the CPR unit. However, the tongue is blocking that airway, so nothing is getting down into the lungs. If you look at the picture on the right where they slant the head between 80 and 100 degrees, closer to 100 degrees, you can see that the tongue is now moved out of the way, and oxygen that is given during CPR is allowed to get down into the lungs. Approximately 21% of oxygen goes into the lungs during CPR, which is equivalent to the oxygen that is in the air at this time. At times, people are really confused as to what is considered normal breathing versus abnormal breathing. Normal breathing is going to be quiet, regular, and effortless. Remember, 12 to 20 breaths per minute. They're not sucking down air. They're just nice and calm as they breathe. So, like after you run the mile, you might feel a little bit winded and you might be gulping down air. That's not normal breathing. However, you're also not dead. You don't need CPR. If you need CPR, your pulse is stopped and you're dead. So you need CPR in order to start breathing again. Remember, for every minute that you go without your heart beating and getting oxygen into your body and through your lungs is a 10% chance that you're going to die. At 4 minutes is when brain death starts. So the sooner you can get CPR started and get the person's airway open, the better it is for that victim. So breathing is normal, quiet, regular, and effortless. It doesn't take you anything to breathe. It shouldn't be making any weird noises. So if you know someone that's got sleep apnea, where they go moments without breathing, they sound probably pretty bad, kind of like a weird snoring. There's also something called agonal breathing, and that's very irregular gasping or shallow breath. So think about someone that maybe you know that is on their deathbed. They're really gasping for air. They're having a hard time getting oxygen in. Usually it's right before the very, very end. And a lot of times patients that have agonal breathing are bagged and going to be intubated, which is where they put the tube down the throat. Usually your pulse is less than 20 beats per minute, and you know that your pulse should be closer to 100 beats per minute. If you see someone that's got agonal breathing while they might be breathing, they need CPR because they are near death. So for probably the third, fifth, or 10th time, since I like to repeat myself, normal adult respiration is 12 to 20 breaths per minute. Remember that adults breathe at a slower rate than children or infants because our lungs are a lot bigger. In an infant or in a child, they have to breathe slightly faster in order to get enough oxygen to circulate throughout their body. So if you see a child breathing faster than you, that's completely normal. Remember, for CPR purposes, a child is someone under the age of 12, but over the age of 1. And infants have tiny lungs, so they're under the age of 1, and they're going to breathe more shallow and a lot quicker than you as an adult. After you have done your scene survey to make sure the scene's safe, your primary survey, which is 10 seconds, look, listen, feel, and the are you okay business, you've decided they need CPR, you need to make sure that airway is open. So look, listen, and feel for breathing. If you don't open the airway, you're not going to be able to feel if they breathe or not. So I'm going to have you show me with one of your classmates what this looks like in just a second. You also need to look towards the chest to make sure that it goes up and down. If you put your ear down over your partner's head and you look away from their chest, you can't see if it goes up and down. Yeah, that's common sense, but because sometimes people don't think in an emergency, the more you practice, the better you get at the skill. So you're going to look to see if their chest goes up and down, put your ear down over their chest and listen for escaping air. Feel for the breath on the side of your face. You do this for no more than 10 seconds. That is a test question on the CPR final, so make sure you remember 10 seconds. Again, before you can do anything to check for breathing, you have to open the airway, which means you want to slant the head close to 100 degrees if it's an adult. I am going to go ahead and demonstrate some of the skills that we talked about today on one of your classmates. So remember that your classmate is still alive, but you're going to simulate like they are in need of CPR. So you will have them lie flat on their back. We're going to practice opening the airway, both traditionally and doing the modified jaw thrust. And then we're going to look, listen, and feel for no more than 10 seconds. This is considered a skill check, which is an assessment, so make sure that you pay attention and take it seriously. There will be a quiz over the last 6 slides. Please go back and review the information from today as many times as you need in order to successfully pass the quiz tomorrow. Good luck, and I'll see you then.